Welcome back, everyone. I hope you've all enjoyed our first session of the morning. I want to say a big thank you to Justina and Alicia for that fantastic accessible summary that you both did. I think we go on as researchers, don't we, as academics, but the ladies did synopsised the sessions beautifully, so thank you very much. So welcome to session 2. I want to just let you know that there are some really interesting poster presentations at the back of the room on the screen. Stephen and Keane are displaying them there. You may not have been aware of them, so take time to review them. There's some very interesting research projects that are presented there, and I hope that you enjoy them. So, to begin our next session, I want to welcome the co-leads of Working Group 1, Dr. Margaret Denny and Dr. Oliwia Kowalczyk. Dr. Margaret Denny is an academic, researcher and educator with over 25 years of experience in higher education, applied psychology and healthcare education. She is an assistant professor at the University of Maribor, where she teaches in applied psychology. Her work focuses on teaching and learning methodologies, curriculum innovation and evidence-based educational practice. Dr. Denny has collaborated on numerous European research initiatives, published extensively internationally, and is recognised for advancing innovative, inclusive and student-centred approaches to education and professional practice. Dr. Oliwia Kowalczyk is a psycho-oncologist and researcher with primary expertise in cancer prevention strategies, particularly focusing on early detection and behavioural interventions across diverse populations. She specialises in addressing the unique healthcare needs of people with intellectual disabilities, developing accessible communication protocols and supportive care models. Her work bridges critical gaps in healthcare delivery for underserved communities, and Dr. Kowalczyk currently works at the Department of Oncology at the Nicholas Copernicus University, where she contributes to international research initiatives to improve cancer care outcomes. So Margaret and Oliwia are going to present to you the work of Working Group 1, which has been extensive, and they have done huge work in their roles as co-leads. So welcome Dr. Denny and Dr. Kowalczyk. Thank you.
Welcome to our presentation this morning, and my co-colleague, Dr. Oliwia Kowalczyk, whom I've worked with together now for
4 years.
4 years, and nothing like having a co-pilot. So we have standard operating procedures like pilots. But anyway, here we go, and to reiterate, this was one of the last photographs taken of John with our present chair, Dr. Suzanne Denny, and it was such a happy occasion in Warsaw.
Right, it was.
Wasn't it?
John was
Do you remember?
in Warsaw last time.
Yeah. It was just brilliant. So, to get to where we're at in Working Group 1, we first probably need to explain what we actually have done and what our deliverables were as part of that project.
Right, so the first of the deliverables was our working, for our working group was, oh, okay. Was to organize a training school, and the training school took place in 2024 in September in Prague. It was extraordinary event, and we came so close and even closer to all the colleagues and our guests, co-researchers who took part in it. And that was a huge part of the journey that just began then. It's hard to believe it's the end of it.
Yeah. And so much organising, and we're so grateful for people with higher and lower support needs in terms of intellectual or developmental disabilities who supported us during that journey. And they registered for the cost action, which was huge for a training school. So we're indebted and eternally grateful for their support and their encouragement and their participation during that training school in Prague.
Right. The second deliverable was the short-term scientific missions. We had 3 of them in our working group. One of them was yours to Slovakia. And I had the pleasure to host 2 of them. It was Dr. Suzanne Denise and Dr. Idalia Ibrahim, who is back there waving to us. She came to my university from the Ministry of Health in Egypt, and we were discussing accessible materials for all populations, really, including people with intellectual disabilities, but also for any other women, and how to help them understand the prevention of breast cancer and how to develop the tools. And we were showing her our tools we are using at my university in Poland. The third deliverable was the protocol.
Oh, God.
Hard work.
So we're going to deal with the protocol in terms of the slide delivery, but one of our main deliverables, I'm to go over a bit. Oh, talk into the mic. Okay, one of our main deliverables was the development of an evaluation protocol for services and for people with intellectual disabilities. And that evaluation protocol was the development of a tool that would assess for services. How are we doing in relation to cancer prevention? But equally, that was for people with higher and lower support needs in an easy read version, for people with intellectual disabilities to say, how is the service doing in relation to cancer prevention? And that for me was the most important area. But of course, the service has to be at the centre of all evaluation in terms of cancer prevention for people with intellectual disabilities. And finally, our last deliverable was working with Vladimir. I don't know, is Vladimir there?
Yeah.
He's the lead of Working Group 4, and in terms of publishing and dissemination and photography and LinkedIn and Facebook and Twitter and you name it. So he disseminated all of our work throughout the last 4 years in terms, and thank you, Vladimir, for that. We often see like dissemination as something that happens, but it's so important for the project to have that impact in terms of what we're doing and how it's impacting on society, but all of us in relation to cancer prevention. So it's not just people with higher or lower support needs, it's society, because when you highlight cancer issues, they're relevant to all of us, and we're all in it together. So will I go? Keep going?
Go ahead.
So we had 3 key tasks as a result of this dissemination, or as part of the deliverables. And our first task was, like, in terms of promoting inclusive networks, and we certainly have made very inclusive networks with 27 countries as we progress through this Working Group 1 deliverable. Research and training. I know CUPID is not about research, but however, as academics, we always submerge ourselves in terms of evidence-based practice and what's best practice. So for sure, it was research and training. And knowledge exchange, which is key. Unless we exchange that knowledge, we're not going anywhere in terms of disseminating what the impact of our CUPID project is having on people, all people. And at the centre of that is the voice of people with intellectual disabilities, with higher and lower support needs. This is not just about lower support needs, it's about higher as well. So our evaluation protocol targets everybody. Okay, Oliwia. So how we achieved, I'm going to pass you over now to Oliwia. So 1.
Right. So it is the training school in Prague. As you can see, we do have still a lot of people among us today. So it is a great pleasure to see you all today again. The key outcomes of the training school were the 5 of the ones we have here in the slide. The co-production is number 1 for the whole project, and this is something we believe in, and this is something we believe needs to be done when speaking or developing anything that has to do with health or any other topic for a group of people. This group of people needs to be with us and co-producing anything that comes out in the results. Cancer prevention knowledge is something that is the main topic of the cost action we are in, but as a person closely in cancer and cancer prevention as one of the oncology department team, I believe this is something that is important for all of us. Cancer is among us and will be among us for a longer time. All the statistics show that the levels are higher and higher. It doesn't want to stop. So building understanding of why screening is important, what it does to us, building the health prevention and health promotion programs is something we want to work on. And I believe we will not stop even if the CUPID stops. I'm looking at Suzanne right now.
We're all looking at her.
Yeah.
You're the leader.
Yes. Where accessible communication is something we need. We need the tools, we need easy read standards. There are some standards, but are they accessible? Are they really well developed? Are they really used among our societies? This is the question, and it's something we wanted to look at closer. European collaboration is something we are most proud of, and is something that is with us for probably next years. We've started new projects, and we know we will be in touch with a lot of people here for a long time and long years in developing what we've just started. Research and training capacity, where yes, we've managed to invite young researchers to our CUPID project, but we also are sharing with them our knowledge and inviting them to collaborate in other projects as well that have to do with cancer prevention and people with intellectual disabilities. So it is something we take home with us and we take for next years to come.
So that's just a group photograph of our training school in Prague. Hello, Fabrizio. You seem to be in the center there. Hello. Yeah, that was just a great event. We developed a training school book, and that's available with a DOI on Zenoda, and it's on Book Creator. And you can, if after this conference you can go into the website, Vladimir has it well set up there, and you can access that code and see the book. So that's freely available. We don't have time, it's beyond this presentation to go through it, but it's quite descriptive and goes through the videos of the lived experiences performed by Sinead and Dr. Sinead and Dr. Suzanne Denny I think were instrumental in having the lived experiences as part of that workshop with people with intellectual disabilities. And for me, that was the epitome of the conference, yeah. So how we achieved number 2, well, that was a short scientific mission in Slovakia, in Kostushe. I don't know if I pronounce it properly. I know Gabriella is not here today. Professor Gabriella supported me from the university there of Safrik. And actually that was going out to a special school and meeting, and I'll show you a picture of it now somewhat later, but meeting people with higher and lower support needs in this special school and getting them to evaluate the protocol that we had developed as part of an easy read. And I mean, it was amazing. So we went through a presentation on cancer prevention, supported by them and co-presented by them with me and another support worker. And then at the end of the session, we actually evaluated the easy read protocol. So with people with intellectual disabilities, that was just great. And we are now doing a publication and I think a book chapter on that. So yeah, big time. 3.
Go ahead.
Yeah. Okay, so the CUPID project, as Dr. Denny said earlier, and has been an amazing leader for us in terms of this project. But not only an amazing leader, but also supported us in different ways. And I would like to thank you, take this forum here to thank you for all your support to the working group leads. So our impact in terms of the CUPID project, stronger together, better prevention, lasting change, inclusive solutions. And when I say lasting change, we had Cynthia here this morning, and in terms of policy experimentation, we hope that long term will impact policy as well in terms of cancer prevention and accessibility for people with intellectual disabilities. Together we prevent, together we protect, together we can make an impact. And I think compliments to all the team, we're making an impact. Next one, come on. So, the development of the evaluation protocol started out with a plan with lots of meetings. I can't remember all the meetings we had. Can you, Oliwia?
Lots and lots.
Lots of meetings and planning. What kind of questions do we phrase in this? Looking at best evidence in terms of a tool. Now, we weren't going to develop this tool with psychometric properties or components analysis. It was a simple tool in terms of how its development started. We developed it, we reviewed it, we refined it with stakeholders, people with intellectual disabilities. IACID was involved, EASPD. IACID is the International Association for the Scientific Study of Intellectual Disabilities, and EASPD is a service provider. Martin can tell me the name. What's the EASPD stand for? European Association. Yeah, thank you. Just got it lost there. Anyway, so based on all of that feedback, we simplified it, did a version for the service organisations and did an easy read version for people with intellectual disabilities. It was a major achievement,
It was,
I think.
yes.
What do you think?
And we are very proud of it, even though it was extremely time-consuming and nerve-wracking at points, but it was worth it, definitely. We've managed to do something that is needed and will be used and valued for everyday practice when it comes to cancer prevention. So we are very proud of it.
We have already got to the stage of piloting via survey, and we extended our easy read and the evaluation protocol for services to 300 members of CUPID and EASPD and IACID. And we're at the final stages now of the evaluation protocol. We've done a lot of the piloting, and the final step is to pilot the final copies or tools with services and with people with intellectual disabilities. And we hope to do that July, August, September, before the end of the project. How are we going for time, folks? Are we good on time?
No one's checking.
Cheers.
Okay, check, so that we don't go over. So in terms of the evaluation protocol, there are 9 core domains. We looked at governance and leadership, workforce capability, supported decision making, cancer prevention activities, service navigation, accessibility and communication, because that seems to come up all, if you think about this morning, augmentative and alternative communication has to be key for people accessing cancer prevention in services. Doctors need to be trained, clinicians need to be trained, medical teams need to be trained in accessible communication. And I'm sure there's a micro-credential, as Laura would put it. Where's Laura? Her idea. There's a micro-credential there in terms of promoting that type of education for all healthcare staff. So I think that's a really good idea. Don't rob my idea. Okay, perfect. So screening, uptake and follow-up is key. Co-production and participation. You know, there's so many names with co-production, and do we do it in a meaningful way? For sure, we should try to do it in not a novel way, but in a meaningful way. And whether you call it co-design, co-engagement, patient, you know, participation involved in their care, it all means the same thing. We should be all involved in our care. Whether we have lower support needs, no support needs, or higher support needs, and quality improvement. Okay, do you want to, or do you want me?
But you're so good in it.
Okay, I'll keep going, so. You said it.
I just stand there and look nice.
Okay, no, here. So the evaluation protocol for services looked at 4 key areas in terms of performance level. So if you were a service, were you an emerging practice that you were just at the early stages in terms of cancer prevention for people with intellectual disabilities? Were you a developing practice? Were you actually engaging and looking and seeing it as a priority? Had you established practice in terms of evaluation protocols for people in terms of cancer prevention? Or were you at the advanced stage? And based on the data, I don't think anybody was at the advanced stage, or in fact, were more developing, weren't they?
Oh, we do.
Yeah, so
We have-
Olivia will talk about
right.
that. I look pretty now.
I look pretty now. I'll do the speaking. 5
Okay,
minutes.
we're
Okay, so
ready.
we'll rush, and we will not bore you with the data and results. It is in the preliminary phase. I'm working on the results we've obtained. 17 countries to look at, so it's a lot to do. But the very, very first results show that we should be very proud of what we've built and developed, because the organizations say it is very important to have this tool. So it is showing us that our work was for a good reason. It is relevant, so it shows us we've done it well. And vast majority of them want to have it piloted. So this is the next step. We are going to do it over the summer holidays. So no lying down.
No holidays.
For
I'm having
us,
a holiday. I don't know about you.
The final thing will be the protocol that will be given to people in the organization so they can use it in their everyday practice when it comes to cancer prevention, so they know what to look at and how to do it with people with intellectual disabilities and their carers. And we believe it is something not developed before.
No.
It is, it will be the very first one. Yeah, so we should be very happy.
That's just a photograph of the Easy Read in the classroom in Kowalczyk in Slovakia, where we evaluated the protocol, but also did the training. This is going to be up on the website, isn't that right, Vladimir? And people can actually QR code, go in and see the questions that were asked of people with intellectual disabilities and service organisations. They were given the evaluation protocol, the full version, and then they had online the questions in terms of the evaluation. So what you're looking at there are the feedback questions that we were looking for feedback on the evaluation protocols. And we got, as Oliwia said, loads of feedback there, which was great. Now you can access that. So we had loads of meetings, and I'm not going to go into any of those because I know time is running out.
4 minutes.
Yeah, we had the ECR workshop in Amsterdam, the Early Career Researcher workshop, and that was a great success. We had conferences in Milan, Paris, Slovenia, Germany. I know Dr. Sinead and Fabrizio are now going to the IACID in March to present at the conference there. Is it in Munich? July. Pardon me, it's a long day. And then Slovakia, of course. And we, Dr. Oliwia and I presented a webinar titled Beyond Words, and we did that online in terms of alternative and augmentative communication. And that, I hope, went down reasonably well.
And then the presentation is in our resources, Yeah.
And then we had, go back there. These are our publications, and we're out there. We're just struggling on a scoping review. Dare I mention that famous scoping review. Rejection after rejection. And do you know, it's part of being a researcher, isn't it? But sometimes hard to take. But anyway, we're going to persevere and do it. And so, progress on our deliverables. We're coming to an end now. Thank you all for listening so attentively. We have achieved deliverable 1, achieved deliverable 2, deliverable 3 achieved, and 4 almost, but we said achieved, but we have to pilot it slightly. So future directions, pilot implementation July to September, maybe an impact evaluation, maybe down the way another piece of research in terms of doing an impact evaluation on how the evaluation protocol worked within services or with people with intellectual disabilities. So how we need to measure all the time in terms of impact. Continued collaboration and promotion of co-production, because as you said earlier, collaborate, innovate, impact, nothing for us without us. Yeah. And our final WG1 report, and then...
And here is the accessible summary. I'm not sure if Lubita is ready for it. Are you all ready? So Lubita was taking part in my part in the training school about breast cancer. You will later see her in one of the pictures, and now she's helping with the accessible summary. Yeah.
CUPID je istraživač, projekat bavi se osoba osoba sa invaliditetom, teškoćem.
Okay, so CUPID is, as you can all read, CUPID is about cancer and people in intellectual disabilities. So CUPID is a research project, and it's all about cancer and people with intellectual disabilities.
Osobe sa teškoćama imaju često da obave privremeni pregled, rano otkrivanje raka nije pravedno.
So people with intellectual disabilities often find it hard to get cancer checkups. That's not fair.
Na projektu smo zajedno da sarađujemo istraživajući sa lekarima i osoba sa invaliditetom sa teškoćama.
So on this project, we work with researchers, medicals, and people with disabilities.
Uradili smo 3 velike stvari.
And we did 3 good things, big things.
Škole obuke u Pragu osoba sa invaliditetom istražujući zajedno smo učestvovali o raku i o zdravlju.
So we did a training school in Prague, and people with disabilities and researchers learn about cancer and health together.
Posete u školi u Slovačkoj koristili smo kao razmenu jezika
Easy read.
i slike kako bismo pomogli učesnicima da razgovaraju sa lekarima o raku.
So school visit in Slovakia, as the man was mentioned, we used easy read and pictures to help students talk to doctors and about cancer.
Napravili smo alat za evaluaciju. Ovaj alat pomaže proceni da li su programi za
Programi dostupni i jednostavni.
da, lečenje raka privlačeni dostupni javnostima za korišćenje za sve ljude.
Okay, and the third one, we made an evaluation tool. The tool is help check-in cancer programs and fair and easy to use for everyone.
Sva naša četiri cilja su ostvarena.
Dobro. So all our goals are completed.
Napisali smo naše radove koje bi mogli čitati lekari i istraživači.
So we wrote research articles that doctors and research can read.
Objavljeno je završni radovi grupa A.
Nastavi.
Naši alat pomoću programa za programi prevenciju rano otkrivene lečene raka širom Europe da budu inkluzivni i dostupni svima.
So we are publishing a final WG1 report. Our tools will help cancer programs across Europe to be more inclusive.
Svaka osoba zaslužuje pregleda rano otkrivene raka.
Everyone deserves access to cancer checkups.
Thank you.
Well done, thank you. I'll give you a hug. Thank you.
Thank you. Možeš i nju da poželiš.
Thank you.
Thanks a lot. And finally, we finish with the important people absent from, without Suzanne is very much there, but our dear John and our dear Eleanor. It wouldn't be right not to finish with them. Thank you all. Thank you.